Hello, welcome to my channel. Before moving on to the video, if you liked the video, like the video, and subscribe to my channel. Thank you from now. What is aplastic anemia? Outline. Aplastic weakness is a condition that happens when your body quits delivering sufficient fresh blood cells. The condition leaves you exhausted and more inclined to diseases and uncontrolled dying. An intriguing and difficult condition, aplastic frailty can create at whatever stage in life. It can happen unexpectedly, or it can come on leisurely and demolish over the long haul. It tends to be gentle or extreme. Treatment for aplastic weakness could incorporate meds, blood bondings, or an undifferentiated cell relocate, otherwise called a bone marrow relocate. Causes. Analysts trust that most instances of aplastic weakness are because of the insusceptible framework going after solid bone marrow cells, as per Nord. Specialists have likewise distinguished a portion of the potential reasons for this safe framework reaction, including openness to benzene, a substance used to make plastics, manufactured filaments, colors, cleansers, and pesticides. Insect spray openness. Non-viral hepatitis. Pesticide openness. Prescriptions, for example, chemotherapy medications, or chloramphenicol. Hepatitis. Pregnancy. Rheumatoid joint pain and lupus. Disease. Other irresistible sicknesses. Be that as it may, specialists normally can't pinpoint the fundamental reason in most aplastic frailty cases. At the point when the reason is obscure, specialists allude to the condition as idiopathic aplastic paleness. Symptoms. Side effects. Side effects of aplastic frailty include dizziness, easy bruising, fatigue, headache, irritability, lightheadedness, pale skin problems, breathing weakness. These side effects might be serious. Certain individuals might have heart-related side effects, for example, chest torment. Diagnosis. A specialist will begin by getting some information about an individual's side effects and their clinical history. They will for the most part utilize a blood test known as a total blood count, CBC, to assess an individual's red platelets, white platelets, and platelets. In the event that each of the three of these parts are low, an individual has pancytopenia. A specialist may likewise suggest taking an example of bone marrow, which comes from an individual's pelvis or hip. A research facility specialist will inspect the bone marrow. On the off chance that an individual has aplastic sickliness, the bone marrow won't have commonplace foundational microorganisms. Aplastic frailty can likewise have comparative side effects as other ailments. For example, myelodysplastic disorder and paroxysmal nighttime hemoglobinuria. A specialist will need to preclude these circumstances. In some cases, an individual with other ailments can create aplastic weakness. These circumstances include ataxia pancytopenia disorder, Fanconi weakness, Schwachman-Joule condition, telomere sicknesses. Assuming that an individual has these circumstances, a specialist will perceive that they are bound to get aplastic paleness. Treatment. Specialists typically have two objectives while treating aplastic paleness. The first is to decrease the individual's side effects, and the second is to invigorate the bone marrow to make fresh blood cells. Individuals with aplastic iron deficiency can get blood and platelet bondings to address low blood counts. A specialist may likewise endorse antimicrobials as an individual requires white platelets to battle contaminations. In a perfect world, these medications will forestall diseases until an individual can fabricate all the more new white platelets. Specialists typically prescribe a bone marrow relocate to invigorate new cell development in the long haul. For this, a specialist may initially endorse chemotherapy meds to kill off strange bone marrow cells that are influencing an individual's general bone marrow capability. Then, a specialist plays out a bone marrow relocate by infusing the bone marrow into a patient's body. In a perfect world, the singular will get bone marrow from a nearby relative. Nonetheless, even a kin-giver is just a match in 20 to 30% of cases. Trusted source. Individuals can likewise get bone marrow from somebody who isn't connected with them, on the off chance that specialists can track down a viable giver. Certain individuals can't endure bone marrow transfers, particularly more established grown-ups, and those experiencing issues recuperating from chemotherapy. Others will be unable to find a giver that matches their bone marrow. In these examples, a specialist can recommend immunosuppressive treatment. Immunosuppressive medications stifle the invulnerable framework, which preferably prevents it from going after sound bone marrow cells. Instances of these drugs incorporate antithymocyte globulin, ATG, and cyclosporin. As per NORD, an expected 33% of individuals with aplastic iron deficiency don't answer immunosuppressive medications. If so, specialists might consider different medicines, for example, hematopoietic immature microorganism transplantation, and a prescription called Eltrombopag, Promacta. That's all for our video. I hope you liked it. If you did, don't forget to subscribe to my channel and like my video. Goodbye, see you in other videos.